as David said earlier, when gene therapists think about removing CCR5 from a cell, we can do it in one of two ways. The zinc finger approach is just a way that kind of goes in. It's kind of like genetic scissors that cuts out the gene, but there's also strategies based on the gene is still there, but it is no longer able to make CCR5, which is the approach that Calimmune are taking. The zinc finger nuclease, the genetic scissors approach, is mostly being sponsored by a company called Sangamo Biosciences, and they have a number of clinical trials, mostly to date, by taking people's CD4 T cells out and treating them with the zinc finger nucleases and putting them back in. And they've reported data from quite a few of these trials at different HIV meetings. I work with these guys a lot, and even I find it quite difficult to kind of understand exactly what all this data is telling us, but that's entirely because we're still at the early stages of sort of seeing the data that's coming through from these trials. And I think one of the things I really like about this field is nobody's sort of rushing to say, yay, it's working, or yay, it's not working. They're going, okay, we are doing the what's called the first in man, there you go, sorry, first in woman, first in man type of clinical trials where the trials are being done very cautiously, if you like. This is a new type of medicine. It's a gene therapy. It's a gene therapy with these things called zinc finger nucleases. We're going slowly, maybe too slowly for you guys. There's people sitting in the audience who've had this zinc finger nuclease treatment. And it's going to take several years to sort of really understand what the data from these trials is showing us. Having said all that, I don't know, I think it looks pretty good. Basically, most of the people who've had this treatment have higher levels of CD4 T cells. What we don't know is whether that is a result of the zinc finger nucleases or a result of something else that's involved in the treatment. I think most people would agree with that. And one of the difficulties with these sorts of trials is if you were HIV positive and you were on antiretroviral drugs and it's keeping your virus under control, you're in a pretty good place, yeah? So if you enroll in one of these clinical trials and we give you, for example, a zinc finger nuclease treatment, okay, going to keep you on your antiretroviral drugs, right? How are we going to know if the trial has done anything, yeah? Well, yes, or we need. One of the things that is sort of on the table is you can take people who've had the zinc finger nuclease treatment and you can say, let's take you off your antiretroviral drugs for, say, 6 weeks and see what happens. If this treatment's working, maybe your virus won't come roaring back like it normally does when people stop their antiretroviral drugs. But that's kind of a difficult kind of call, isn't it? Because these drugs are keeping people's virus under check. So do you really want to take yourself off the drugs? So these are not black and white questions, and people who volunteer to be in these clinical trials and the physicians who sort of monitor them throughout the trials really think about these questions quite deeply. I don't know. I'm sorry. I'm looking at Matt in the audience because I know he's spoken openly about being involved in these trials. But let's see. What was your specific question? How are things looking with the zinc finger nuclease trials? But so I will be okay. So I will put my appropriately most conservative hat on, and I will say nothing bad has happened. Right, which you may laugh at, but honestly, that's huge. Okay, when you're trying to do new types of therapies and new types of medicine, when nothing bad happens, that's a home run. Okay, right? And secondly, I think there really is evidence that something good may be happening in those patients. They haven't yet teased out what the components of that may be. But the trials are progressing, I think, at an appropriate level of escalation with appropriate caution and appropriate analysis of what's happening in those trials. And it's probably too early to give you a 30-second answer. Yeah.